So the overarching diagnosis in hepatitis C specifically is that all HCV is associated with leachy, pestilence, epidemic factor. This is very important. I actually mentioned this when we were talking about the herbal treatments and herbs for cancer and viruses that cause cancer. So that's really simple. What does toxic heat have in its diagnostic process? The symptoms can include sensations of heat, agitation, itching. And interestingly enough, most people with hepatitis C have these symptoms. The tongue may have red spots, as I showed you before. Sometimes a red body, sometimes not. You notice that the tongue that I showed you was a pale tongue that had red spots. It's the red spots that are important. The tongue also, at some point, may or may not have more stagnation of blood stasis that's showing under the tongue in terms of the veins under the tongue. There's so many different aspects. One of the things that we will do in the course when people come to San Francisco is that we will be doing grand rounds in which we will be looking at many different types of people with hepatitis C at different stages, so you will actually get a chance to see what the tongues actually look like in those cases. And the pulse, there's a rapidity to the pulse. And that's pretty much true across the board, no matter what other diagnoses there are associated with toxic heat. And this is actually somebody who actually has hepatitis C. And interestingly enough, when people go on antiviral treatments, interferon treatments, oftentimes these things change. So it's kind of interesting to note that. So in addition, there are 10 traditional Chinese medical patterns that are specifically associated with acute and chronic viral hepatitis. I know that many of you learned about hepatitis in school, but just kind of rotely learned some diagnostics. But what's interesting is much of what you learned is what I'm going to review now, because hepatitis and viral hepatitis is hepatitis. It's just you may not have recognized until you actually see people in the clinic how it applies. And so the patterns, again, are diagnosed depending upon the physical exam and an individual symptomatology. And so you really need to do these things and not make an assumption. Even though this is an epidemic disease and toxic heat is always there, then there are at least 10, if not more, traditional Chinese medical patterns. And the most common initial patterns are spleen, stomach, and liver patterns. I think that before, in the 6-hour class before you joined this class, there were some slides that went over all the different types of symptoms that are associated with hepatitis C. And one of the things I want to remind you about is that many of the symptoms that are found in hepatitis C are associated with the spleen and the stomach in Chinese medicine, not the liver. And so while it's a liver disease according to Western medicine, and even though it's also a disease of other organs as liver disease progresses, very similar to Chinese medicine in that way, it's the spleen and stomach and digestive issues and the issues that are associated with the spleen and stomach, which are very important early on, especially with people with more deficiency. Spleen and stomach patterns are more common and are found really early on. So the excess syndromes are that are associated generally with acute hepatitis and increased liver enzymes. And when I say increased liver enzymes, I mean very, very high levels in the hundreds and thousands. That's at the very beginning. However, these syndromes that exist at the beginning may also persist in chronic hepatitis, along with the additional syndromes that develop as liver disease progresses. So some of these are associated with the early stages, and then as you move along in the process, they may be added onto or transformed into other patterns. So I'm sure that some of you have seen people with acute hepatitis and will recognize this syndrome. I think that this is what you tend to learn in school is about acute hepatitis. And so the predominant acute hepatitis seen is liver gallbladder damp heat, where these syndromes, these symptoms that are in the syndrome, I'm only including the ones that are associated with hepatitis or viral hepatitis. So, of course, a bright yellow face and eyes associated with jaundice. You can have fevers, you can have constant pain, which can be severe. It can be on the right side and or the left side, primarily the right side. Nausea. The pulse can have a wiry quality or a slippery quality, depending on whether there's more dampness or there's more liver gallbladder aspects that are showing. The tongue is often red with a yellow greasy fur. The spleen damp heat, which actually is found in early hepatitis C as well, where there might be a bright yellow face, abdominal pain, nausea and jaundice and fever. But in this case, the spleen is associated with the decreased appetite. So the pulse, of course, does not have a wiry quality because and that's one of the predominant differences, is that the pulse doesn't have any wiry quality but has a slippery quality. And the tongue, though, is very similar in that it's red with yellow greasy fur. And now there's a less commonly found but also early diagnosis of acute hepatitis, where there's spleen damp cold, this excess condition. This is where we see the sallow yellow face associated more with damp cold in the spleen. Abdominal pain and nausea, so feeling cold despite having fever, decreased appetite. This pulse, while it may be slippery, it also could be tight related to cold pain. And the tongue is often pale with a greasy white fur, which is quite different than the damp heat type of diagnosis. Now, one of the things that is important here is that most people do not know when they have acute hepatitis C. Very, very small. If you remember going back and reading the epidemiological portion of the class, you can see in the transmission, I just want to remind you that there are a very small number of people who actually know when they're acutely infected. Now, those people tend to be pretty lucky because they know that they've got something going on. They'll see a doctor right away, and they may actually be able to get Western treatments or other treatment that prevents them from having chronic hepatitis C. So these are the stages in which that is important. So if you see somebody with this type of condition, with this type of acute hepatitis looking condition, you may be seeing somebody with acute hepatitis C. Often it's acute hepatitis A because that's usually what you see, or hepatitis B, but it could be hepatitis C. And if you identify that early on, you may be able to help somebody to prevent getting chronic hepatitis C. So I think that's important for you as a practitioner to understand this process and the diagnoses